Hi loves, welcome back to my channel. It's your girl Stephanie Michelle, and in today's video I'm going to be sharing with you guys my tips and tricks on how to pass the Nclex on your first attempt. Okay, but before we get started, I just want to say, do not expect to know everything. It is okay to not know everything. You are still learning. Even when you get into the field, you're still going to be learning something new. You're being tested on like the basic knowledge. Do you know how to keep someone safe and what to do if you see a critical lab, things like that. But you are not supposed to know everything, so do not believe that, okay? Second thing is to do not get discouraged if your test go past 75, 85 questions. I know that they have this little rule that if your test keep going past 85 questions, you failed, which is not true. And I could attest to that because my test went up to 120 questions. And I was one of those people that was like, oh no, I failed. It's past 75 questions. At the time, it had to be 75 questions. It is past 75 questions. I knew I failed. Your girl passed. So do not get caught up on the fact that you're supposed to stop at 75, 85 questions to know that you passed. It's not true. Okay, now that we got that out the way, let me just give you a little bit of backstory. So I attended a 15-month accelerated program. I started February 2021 and I was finished July 2022. However, I did not get my ATT number until October. Your ATT number is the number that you need in order to even schedule your Nclex. I didn't get it until October. So when I went to schedule my test, I didn't have anything until November. So I took my test in November. Now, during that time, I cracked down. It's study time, okay? So what I did was, I always did like the reviews in the back of our books, like the books that you get in school. I always did the questions and answers in the back of the book. I did Hirsch review. I even did the ATI questions. So my instructor in school suggested that we do 200 questions a day. And I really was doing 200 questions a day. Oh wait, I forgot to mention. Y'all are going to be getting ready with me because I do have some errands to run. So while I'm telling you my tips and tricks, I'm going to be getting ready. So if I'm looking over here, I'm looking at my mirror, okay? All right. So anyway, I was doing the 200 questions. I know some of my classmates was looking into the Archer and the, is it U-World? Archer and U-World, where you pay for it and they kind of go over, I guess, questions that might be on the Nclex. It's like study material, it's questions and answers. However, I was like, I'm about to pay all this money back for school now. I do not want to pay $300, $400, $600 to attend like a little, review. Like, I just want to try to get this on my own because I don't have that extra coin to spend. Now, I also heard that Mark K was great at teaching you the basics and giving you like a guideline on passing this Nclex. So what I did was I hopped on here on YouTube and I started searching Mark K. I found this very cool channel who had Mark K lectures. I guess they was in class, they was recording, which he allowed you to do. Mark K lectures. And when I tell you, that was the best thing that ever happened to me. Okay, so at the time, I was still working as a medical assistant. So on my way to work, I was listening to Mark K as if Mark K was the radio. Seriously, nothing else. Mark K listening. And what I liked about that was that I did not have to like take notes. I didn't have to look at anything. I could just drive and listen, which was such a breeze. I did that for a month straight. That's really all that I did. Okay, so I'm listening to Mark K, doing my thing. And I didn't want to like overcrowd my brain all at once. That's another thing. Give your brain room to like absorb this information. Give it a chance to rest. Like, do not try to cram so much information in because that don't help. Tip number one is going to be stop second guessing yourself. It's as simple as that. And I too was someone who second guessed myself. And then I'd be mad because I'm like, oh my God, that was the first thought. That's what I thought it was. But then I felt like maybe I'm wrong. So I picked something else. 9 times out of 10, when you second guess yourself, you're going to get it wrong. That's why a lot of times we find ourselves failing in these tests because we second guessing ourselves. Whatever answer comes to mind the first time, go with it. You're right. Your brain is letting you know this. Okay, so that is tip number 1. Okay, so my tip number 2 is when you are taking this test, I want you to not pay attention to all that unnecessary surrounding information. That is there to trick you up and throw you off, okay? Read the question, pay attention to the question, and answer only the question. All of that noise in the background is there to distract you, okay? For example, if a question say, you have a patient who is having trouble breathing, he has a cast on his leg with, some soilage and just came back from the ER 3 days ago. What should you do? They want to know, if this person is having trouble breathing, what are you going to do? Don't pay attention to that cast on his leg. Don't pay attention to the fact that he came from the hospital 3 days ago. That's blah, blah, blah. The sky is blue. It is a whole bunch of unnecessary information. And they'll give you a whole paragraph on it just to trick you up. Pay that no mind. Trust me. Block all that noise out. Block all it out. Look at the question. What is the question asking me? Okay, focus on only that. That's it. The next thing I want to talk about is priority questions. Now, these could be a little tricky. Priority questions could be very tricky because a lot of times all of the answers are correct. All of the answers will be correct. However, they want to know what's most important. What is the first thing you should do? They're the keywords that you should look out for. Most, first, things like that. So for example, a patient is experiencing a myocardial infarction. What is the most common symptom of a myocardial infarction? Okay, most important. So you'll have answers that say shortness of breath, fatigue, chest pain, lightheadedness. All of them are correct. All of them are correct, but what is the most common symptom? The most common symptom is chest pain. So you get how all of it was right? Like you looking at it like, okay, this. You're like, wait a minute, this is correct. No, this is correct. They all are. But pay attention to most and you'll be good. Another thing I would say is to remember that the sickest person is top priority. Okay? So it's acute before chronic. The reason for that is that acute is a new onset. Chronic is something that has been established. It's been established. We already know about this. This is just your baseline. Acute is something new. It's unexpected. So yes, we are going to cater to the acute before the chronic. And the sickest person, even if you have a disaster, a bombing or something like that, remember that the sickest person is top priority. My next tip would be try not to memorize everything just how it is. What I mean by that is you can get caught up on a question. You know the answer, but being as though you memorized it one way, but it was presented to you and the answer a different way, you feel like you don't know it. What I mean by that is, say you get a question where it say, the patient is on a high protein diet, right? Which one of these food items is high in protein? So you would have fruit, bread, poultry, nuts, rice, things like that. And you like, oh my goodness, the answer is chicken. I know the answer is chicken, but I don't see chicken here. I don't see chicken here. Oh my God, I don't know the answer, but you do know the answer. The answer is poultry. Chicken is poultry. So you get what I'm saying by like memorizing just chicken. If you ever see a question about protein or something like that, the answer is chicken, that when you see it delivered in a different form, you feel like you do not know it when you do know it. So yes, memorize it. Don't get me wrong, because I had to memorize some things. I'm not lying to you. Memorize it, but also take it a little further. Also try to understand it if you can. If you got time to, because I know we be in these accelerator programs. Try to understand it just so you don't get caught up like that. Start freaking out and choosing the wrong answer all because you memorized it a certain way and it was not presented to you in that way. Oh, another example. You have a woman in her first trimester of pregnancy. What should you give her if she's experiencing nausea? Okay? You got milk. You got dry carbohydrates. You got ginger ale, stuff like that, right? You probably remembered crackers, saltine crackers. Now, we all learned saltine crackers. Give this woman some saltine crackers to reduce the nausea. However, saltine crackers is not there. So what you do? You panic. You feel like, I don't know, oh my God, where's crackers? What else can I give her? When the answer is dry carbohydrates. You get what I'm saying? You know the answer is still there. They just tricked you up. They want to give it to you a, upfront, basic way. So they tricked you up a little bit and got your mind thinking a little bit to see if you really know what you know. So try not to just memorize everything. Try to also get a better understanding. Go a layer deeper. You just need a layer deeper and you'll be okay. So my next tip would be to rule out absolutes. You're going to see questions that have the words always, never, all, and all of those are wrong. They would not be the correct answer. Reason being is you cannot prove that. You cannot prove that all or never or always. You cannot. However, you're going to find those in your answers. Know that when you saw that, you can eliminate that answer automatically. So now we're breaking it down to last answers to choose from because we know those are not the ones. Rule out absolutes. No, they are wrong. Also, if two answers are the same, 9 times out of 10, they're both wrong. They cannot give you two answers that are the same. So, they are wrong. You can throw them out as well. Throw them out and then you just have maybe 1 or 2 other options to choose from. We're narrowing it down. We're doing a process of elimination, okay? So yes, rule out absolutes. 2 answers the same, throw them out. I want to talk a little bit about peds. What I want you to understand about peds is you have to give children time to grow. You have to give children time to grow. All children are not the same. Some is faster than others, and that's okay. That's normal. Everyone is different, but you have to give them time to grow. So, if you have a question and it's saying that you have a 6-month-old baby boy, at 6 months old, what should he be able to do? So, you want to pick the simplest, easiest thing for a child to do. The easiest thing that they have listed there, that's your answer. So if it say, at 6 months, he should be able to crawl. At 6 months, he should be able to hold his own bottle. At 6 months, he should be able to hold his head up. Or at 6 months, he should be able to hold your hand. Okay? Your answer is, at 6 months, he should be able to hold your hand. Easy breezy. Do not, say that he's supposed to be able to walk, he's supposed to be able to cross, but no, give him the simplest thing to do because you have to give children room to grow. Pick the simplest thing, the easiest thing, and that is your answer. Also, while we're on peds, make sure that you always give them finger foods. Always finger foods. If you see something about children and they have a list of foods, make sure you're giving a child finger foods. Just a little pointer for you. Finger foods. Okay, so now let's talk a little bit about pharmacology. If you know the drug but does not know all of its side effects, pick a side effect that has to do with the body system that the drug is working on. You follow me? Okay. So for example, if you have a cardiac drug, pick a side effect that goes with the heart. You might have palpitations, shortness of breath, low blood pressure, anything that is surrounding the heart. It's the easy way to always pick or choose a correct side effect if you just focus on the body system. Also, I would say a trick is to group meds by their suffixes. So, that was the easy way for me to learn. Group them by their suffixes. That way, if I hear one that sound like this and I hear another one that sound like this, I know that they all in the same drug class, okay? So for instance, benzos. Benzos in Lamb and Pam. The way I remember it in school is Lamb and Pam driving a Benz. That was the easiest way. I promise you, it stuck with me. It stuck with me. Lamb and Pam is driving in a Benz. Okay, so that way, you know, lorazepam, clonazepam, all of the Pams and Lambs is benzos. Okay? Wasn't that easy? That was easy. Just group it together. Same thing for beta blockers. And then in LOL, we have propranolol, atenolol, metoprolol, carvedilol. We have the laws. The LOL is beta blocker. So you see what I'm saying? Even if you never heard this medication before, but the suffix is a LOL or the suffix is a PAM or a LAM, you're like, oh, okay, I know what drug class, what drug group that falls under. Easy breezy. That's the only way, because pharmacology was hard for me. Pharmacology was kicking my butt. So we know that if you know the drug but you do not know the side effects, just pick a side effect that has to do with the body system that the drug is working on. We know that we are going to group these medications by their suffixes, and we're going to group it all together. We're going to know what they are just by doing that. A last tip I want to give you is to Give yourself time to think. Do not try to beat the clock. Okay? Do not pay attention to that clock when you're taking a test. Often when we rush, we mess up. We mess up when we rush. Give yourself time to break the question down. Give yourself time to analyze the question and think about it for a second. Sometimes the brain needs time to think. Don't stare at that clock. That clock will scare you. I think I took all my time. I didn't take no breaks either when I was testing. I didn't take no breaks. I sat there the whole time. So I'm gonna give you like some type of example. I'm just throwing examples out here to you guys. I'm not saying this is on the test. I just want to give you guys examples so that you understand what I'm saying. So, how to know if someone is experiencing low blood sugar or has low blood sugar, is having a low blood sugar attack currently. How would you know? So even if you never saw it before, you don't know exactly what it looked like. Let's just try to break it down a little bit, right? So low blood sugar. Epinephrine is kicking in, right? Epinephrine is kicking in. That fight or flight response is kicking in. Our temperature is raising. We are going to start sweating. We are sweating. This person is going to have diaphoresis. And it always starts off. 9 times out of 10 starts off in the hands. You're going to have clammy hands. It's going to be sweaty. It's going to be clammy. So even if they look like they're okay, but you see these sweaty, clammy hands, think low blood sugar. Check their blood sugar. The clamminess is a sign of low blood sugar. So there you go. You broke it down. You thought about it. Low blood sugar. My body is reacting to it. My body is fighting. Epinephrine is kicking in. Fight response is kicking in. I'm starting to sweat. I'm starting to heat up. You broke it down. You gave yourself time to think. Give yourself time to think. So guys, before I actually bring this to a closing, I want to say congratulations to you. Congratulations to you. If you are watching this video, I'm going to assume that you are either in school, you're either about to attend nursing school, you are about to take your Nclex and just want a little bit of support and want to feel confident and get test taken. I want to say congratulations to you. You got this. Believe in yourself. Know that you got this and you will be okay. Keep going. I don't care if your first attempt isn't a successful one. You go for that second one. I don't care if you go for the third one. You just keep on going. You got this. I hope that my tips and tricks have helped you in some way. So that is the end of this video. I hope that you guys enjoyed. If you have any further questions, please leave it in the comments below. And I will try to respond to you as soon as possible. You got it, girlfriend. Until next time, bye.